A very warm welcome to all of you to the second webinar conducted by ACT. Thank you so much for taking the time to attend this session today. We are really excited to introduce the two innovators we have with us today, Karkinos and Selco Foundation, to all of you. I'm Rachna and I'll be your host for this session. So I'll quickly take all of you through the objectives and agenda for this session, and our speakers will take it from there. Before we begin, just a humble request to the audience to remain on mute while our speakers are presenting. I would also encourage all of you to please use the chat box on the right side of the window to continuously ask any question or have a discussion. We'll answer or discuss these questions at the end of each speaker segment. Another request that we have, we'll be sharing a feedback form in the chat window. Request all of you to please fill that up, as it will help us in channel our efforts in the right direction. With that, let's get started. As a quick background, ACT brought together and has worked with a variety of stakeholders from the healthcare ecosystem to help mitigate the impact of the COVID pandemic in India. Along the way, we created meaningful connections with a network of technical experts, enablers, implementers, and volunteers. And this network has been actively working to strengthen the healthcare ecosystem. We believe that this network has a much larger role to play in creating social impact in India, and want to build and nurture this network into a community. As part of our community engagement initiative, we are conducting a series of webinars among other initiatives. Today's webinar is the second in this series, and it's an attempt by ACT to connect various stakeholders such as government officials, hospitals, and NGOs with innovators working in the healthcare space. Our objective here is to trigger meaningful dialogues among the stakeholders and such innovators, which we believe will eventually lead to positive change in the healthcare infrastructure in India. In terms of agenda, in our first segment, we have Colonel Sadbir from ACT with us, who's been instrumental in the deployment of over 100 PSA plants pan-India. He's going to speak about some of the work done by ACT during the second COVID wave and the wider impact it has had. In the next segment, we have our first innovator team, Karkinos, who have a bouquet of offerings that assist healthcare facilities in screening and treating cancer patients. Karkinos is going to speak about the cancer care space in India and the work they are currently doing in this space. This would be followed by an interactive question and answer session with the team for roughly 10 minutes. Request all of you to please use this time to ask any questions or trigger any discussion you may want to have with the team Karkinos. In our last segment, we have a team from Selco Foundations. Selco has been actively helping healthcare institutions migrate to solar energy powered facilities. They are going to be speaking among other things about ecosystems for the healthcare energy nexus in India. With that, without further ado, I would request Colonel Sadbir to kick things off. Sadbir, over to you.
Thanks, Rachna. Thanks a ton. It really excites me here to maybe change roles slightly here and maybe take on a small brief about ACT here. So ACT has been doing a lot of wonderful job as far as the COVID crisis is concerned. In the wake of response to the second wave of COVID-19, ACT has done a lot of things. We are working on 3 pillars. One was oxygen supply, second was vaccination efforts, and third was the home care front. So this is where I get really excited when I bring forth to you the ACT Impact Report, which we have put in a lot of effort here. The summary of the ACT report is we've been able to donate 41,820 OCs. Total of 9,636 cylinders have been delivered. 2,318 BiPAPs have been delivered. 106 PSA plants have been commissioned. On the vaccination front, we've been able to vaccinate more than 550,000 people. 347 million plus audience has been reached through the vaccine hesitancy digital campaign. More than 176,000 COVID care kits have been commissioned. Trainings have been organized for more than 145,000 plus frontline workers. 3,500 plus hospitals have been connected to, courtesy which I think we have such a august gathering here today also. In this process, in this journey, we've been able to connect with more than 70 plus NGOs. 50 plus strategic partners have come along with us. 33 states have been touched upon. More than 500 districts have been reached out to. And the best part about the entire process was that more than 350 plus volunteers have come together and held hands to work in this process. So I proudly present this ACT Impact report to you. I would be sharing the link in the chat box. And I would request that everybody, whenever you have time, you must have a look at the report. And that will give you some sense as to what sort of impact we as a community, ACT as a community, has been able to impart. And we hope that with such a positive motivation from all of you, with such a solid response from everyone, I think this is just the beginning and we would be going miles from here. So we're just looking maximum support from you. I just hope this second webinar, which we have today, where we have two eminent partners, Selco Foundation and the Karkinos, who would be sharing their plans. I'm sure that would be again a stepping stone for larger things to come. So won't take much time. I'll pause here and hand over back to Rachna to carry on, because there's no end to what one can speak about, what has been done, what needs to be done. So over to you, Rachna. Thanks a ton. Thank you so much.
Thank you, Sadhbir. With that, I would request the Karkinos team to start their session. From Karkinos, we have Dr. Ajit Nambiar and Mr. Suresh Venkatramani with us. Dr. Nambiar is the Director of Lab Services in Kerala with Karkinos. His expertise are in the fields of oncopathology, histopathology, cytopathology and molecular pathology, with breast and lung as lead areas. And Mr. Suresh is the Chief Business Officer of Karkinos and is an alumnus of the Wharton Business School. He has over 25 years of work experience in the B2B business, internet startups, product and business management. I'll not take any more of your time. With that, over to you, Team Karkinos.
Good evening, everyone. It's my pleasure, privilege, and honor to be here. And I would really like to thank the entire team, Sadhbir and Rachna and the team, for giving us this opportunity to share our thoughts about what we've achieved so far and where are we embarking on from a Karkinos standpoint. Cancer challenge in India, in my view, I'm sure most of you are aware of. Having said that, over the past 18 months, a lot has been spoken about COVID and the impact of COVID. But a time bomb, which is kind of waiting to blast, is the cancer problem in India. And if I were to give you some insights about the current cancer situation in India, if I look at the real incidences are close to 4 to 4.5 million. And the reported cancer cases are close to about 1.5 million as of 2021. And if you look at the 5-year prevalent cases, it's close to 3 million. And in 2021, close to 800,000 people have lost their lives for various reasons related to cancer. And we are seeing an annual CAGR growth rate of over 16% when it comes to cancer. And this is a problem that we in Karkinos intend to solve, or rather we are attempting to solve. Though the overall infrastructure in India is focused on the treatment of cancer, we are focusing on the early detection of cancer. And why do we do so? If you look at some of the statistics, as per the National Cancer Registry Program, majority of the cases with respect to cancer are detected very late. If you look at breast cancer or cervical cancer, about 29% and 32.8% of the cancers related to breast cancer and cervical cancer are identified only at the localized level. Same is the case when it comes to a head and neck cancer or a stomach cancer, which is in the ratio of 25.2 and 18.7. And when you look at the lung cancer, we are able to identify only 13.9% and 17% of the cases. So this is the problem that we have. And when I look at the infrastructure that we have, what are the major problems that we are facing? One is the lack of awareness, or rather lack of education. In fact, today, see, the word cancer is a taboo. Even educated people, whom I have come across in the last probably 4 to 5 years, have kind of have a taboo in talking about cancer. It is not spoken well. We have a lot of infrastructure issues, low insurance penetration, high out-of-pocket expenses, and lastly, it is also about the talent shortage. And this all leads to poor, or rather lower standard of care when it comes to cancer. The unmet needs of the cancer care in India, if I were to give you some bit of a statistics from a HR and infrastructure standpoint, what India needs today is close to about 11,000 odd beds, and what we have oncology beds is only about 8,100. Linear accelerators, we need more than 2,000 plus, and what we have today is only 614. Radiotherapy technicians, we just have about less than 1,000, where the need of the hour is about 6,500. And the same is the case with oncologists. And what do we see here is a very, very prevalent trend of long waiting times. Waiting period for an onco surgery, average patient waiting time in a government hospital is about 3 to 6 months, and in a private hospital is probably 1 to 2 days. And the patient inflow, that is patients who are coming from outside the tier 1, tier 2 metros, in government hospitals it is 50 to 70%, and private hospitals it is 30 to 40%. So this is the current model of cancer care in India with lots of gaps. And if I were to look at a case study of a middle-aged woman who wants to travel from a tier 3 city, she probably takes today anywhere between 6 to 8 hours to reach a hospital. And post that, he or she is referred to a mammogram, and that too in a district hospital, not in the city of our choice. And then when you want to go into a tertiary oncology care, there is a huge waiting time. And this whole process kind of takes the phenomenal expense that comes along in the out-of-pocket expenses, plus the time taken and the crucial time that is lost, which could possibly save the patient if detected early. And at Karkinos, we focus on early detection of cancer by massive community engagement programs, participating with NGOs, volunteers, government and quasi-government organizations and entities. At Karkinos, we start with the community workers, create awareness, and what we call it in the screening centers, the community screening centers, what we call it as L4 and L5. Then we take the screening test. Post that happens, what we call it as a digital screening that happens in the community centers, we upload them in the K-Cloud architecture. After that, we take immediate attention and take them to a detection center or a L4 center. And we also have a good bunch of experts who are a part of our medical team, who take care of the virtual tumor board construct as well. And this is, kind of focused on evidence-based care, wasting a lot of unwanted time, and to provide the continuous care for the patient. What do we look at? As I said earlier, we focus on early detection, diagnosis, treatment, care and wellness, and last but not the least, we also look at a clinical and genomic database where we could potentially be useful for pharma companies and research organizations with lots of data and insights with respect to cancer care and cancer treatment protocols. And all of this is done through a well-organized command center where multiple stakeholders, right from the patient to caregiver to doctors and lab technicians and nurses and administrators, all of them collaborate using our digital architecture, where we talk about delinking the knowledge of cancer care vis-a-vis the delivery of cancer care. So the delivery of cancer care is happening through our partnerships with various hospitals, apex centers, or the community centers, where we focus on what is the core knowledge hub of the cancer care pedagogy. Here, may I request Dr. Ajit, who is a part of our, he heads the lab, to speak about what we have done so far with respect to the lab and the infrastructure and also the clinical protocols. Over to you, Dr. Ajit.
Yeah. Thank you for this opportunity. So what we do at the Karkinos is actually, it's a cancer care platform. Now, the lab plays a very vital role because whenever a patient is referred, you need a biopsy, you need to kind of confirm that the person is suffering from cancer. So diagnosis is paramount. And the pathology, which is there, is the gold standard in diagnosis. We go through a lot of tests, blood tests, radiology, but finally, what is the test and that gold standard test is pathology. And what we are looking at histology or tissue, and we look at what we call the histology slides. Tissues are processed and we look at those slides. And now the whole thing has moved. Pathology has had a market revolution from the world of just diagnosis. We are not just diagnosticians. We are also what are called information managers. An information manager is all about using a lot of now further technology. Two very important things hit us in pathology. One is the molecular revolution, which is about genomics, about DNA. And unless we get into that, so Karkinos is very much invested in taking the entire story from the basic pathology right up to genomics and what it does. Why is that we need to do this? Because we are moving today in treatment, we are moving into much more effective treatment strategies. Effective treatment strategies mean targeted treatment. We want to understand which is the pathway the cancer is taking. Go and block that pathway. It works more, it helps. In fact, lung cancer is one such story where this whole thing has moved much forward. And so there are other elements in this, going to do whole genomics where it's all about data and understanding much further, because we are a bit challenged in this country about the genomic data because we bank a lot on the Western data. In order to encourage that particular part is one needs a repository or a biobanking facility, which is also something which Karkinos is investing. So that is what we all work. Thanks, Suresh, for giving the opportunity to kind of highlight what is happening at the lab and in pathology. Over to you, back again.
Thank you, Dr. Ajit. As I said earlier, we focus on decoupling the knowledge of cancer care vis-a-vis the distributed cancer care model of treatment of cancer care. And, as Ajit spoke about, we focus on the managed care model using a central command center, a pathology lab, consulting board of tumor board experts, surgical training and innovation center, and genomic and precision oncology Whereas on the left side, what you see is all our partnerships. And through this webinar, I'm sure a lot of our potential partners are on this call, be it the NGOs or the government or private hospitals. We would be more than keen to partner with you to figure out ways and means by which we can collaborate to eradicate or to kind of detect cancer early. We are trusted by some of the best brands, right from the Tatas to Kaveri Hospital to VS Hospital to Yenopova Deemed University to Roche to Guy's and St. Thomas Cancer Academy to Rakuten Medical. What are our offerings? I mean, for want of time, I'll quickly take you through some of the offerings that we have for whole lot of employees who work in organizations or citizens who could potentially come to any of our centers for a cancer check or a screening. Primarily, the way we go about is once we have a group of people, we first focus on organizing a webinar for them today, because the most important aspect of cancer is creating an awareness of cancer. And we have today, doctors who are globally renowned and oncology experts who can come onto the platform and offer a whole holistic picture about the early detection of cancer and the probability that cervical cancer or a breast cancer can actually be eradicated if detected early. And the next protocol that we follow is a digital risk assessment for every citizen. And these risk assessments are done through our app, and it's all completely done digitally to understand whether the citizen is medium or high or low risk. And basis that, the outcome of the risk scores, we actually take care of an end-to-end patient navigation protocol, which is evidence-based, unbiased, through offered through prevention, screening, diagnosis, and active treatment. And all of this happens through a digital pathway or the command center, where a patient or a caregiver can have access to digital health records 24/7. We also have partnered with multiple hospitals across the country, whereby after, if by any chance, in an unfortunate event of any of the citizens were to be detected positive for cancer, we work with these hospitals to provide discounted rates or preferable rates for treatment. And we also provide a teleconsultation, because as all of you know, cancer is a journey. People go through this journey and they need teleconsultation over a period of time. And we also have partnerships with organizations that provide medicines at a discounted rate and home delivery. The Karkinos Advantage is just more than cancer screening. It's a comprehensive, unique, high quality expertise that we bring onto the table. Today, except the Apex hospitals, unfortunately, no one offers cancer screening. We today offer screening for more than 6 most common types of cancer, major lifestyle diseases, care management. We also provide doctor consultation. And when I look at the wellness and preventive care, the journey so far, I would like to talk about the case studies that we have kind of want to showcase to all of you. We have partnered with multiple hospitals across the country. So far, in the last 3 months, we have done 2,700 plus citizens who have been screened, and 113 plus were identified or rather had some symptom or other for cancer, and 2 patients were successfully treated. And I'm happy to say that without the Karkinos intervention, these patients would not have been diagnosed. And we are super happy as a team that we are able to offer this service. And with the support of all of you, we would probably be able to take it to the length and breadth of the country. Another case study where we did camp for about 200 plus below poverty line women in a remote district in Palakkad, which is by name Chittoor, which is not actually in Palakkad, in Kerala, it's in Chittoor. And we partnered with an NGO. We did cervical cancer screening and breast cancer screening for over 200 plus women. and identified early cancer symptoms in 27 of them through the early screening and detection. And this again, is just a start of the journey. And we believe that, such camps going forward in partnerships with many of you could really help people across the country. And with this, I once again thank all of you for giving me this wonderful opportunity, and would be more than happy to take few questions, if any. Thank you so much, ACT team.
Thank you, Mr. Suresh and Dr. Nambiar. That was really insightful. I would request all the participants to please ask questions if you have any.
Suresh, we have a couple of questions here. So the first question is by Karkinos works in the urban area or rural population, and where should the efforts be focused? So maybe if you can take that on.
Yeah, I mean, I think it's a fantastic question. In fact, we believe in distributed cancer care, and if you look at some of the partnerships that we have today in Kerala, they are all not in the metros. We have a partnership in a place which is about an hour drive from Kochi, which is Todupuzha, where we have a partner hospital. And the case studies that I showed in the presentation, even the camp that we did was actually in Palakkad, which is again in a village near Palakkad. So to me, I think cancer awareness is equally bad even in the metros. I mean, I wouldn't say that educated people are aware of this, but the fact of the matter is the more you go to tier 2, tier 3, tier 4 cities, the affordability and the availability of quality cancer care is definitely a challenge. And we would want to just not focus on the tier 2, tier 3 cities. We also want to focus on the metros where we still see that as a challenge. Dr. Ajit, you want to add further here?
I think what just adding on to what Suresh said was, changing the entire mindset of people. Nobody, as Suresh mentioned in its earlier part, that nobody wants to talk about cancer. We are wanting to change the mindset of, from being reactive, because when you have a problem, you want to go to a doctor. Unfortunately, in cancer, it is a late stage. A late stage is, problematic from the cost of treatment, and also, it is not too effective as far as survival for the patient is concerned. So if you want to go in, we want to go in and make sure that people, the West has shown through case studies across that the best way going out is screening, is early diagnosis, which needs to be, as Suresh rightly mentions, even in metro cities. So therefore, the concept, has to change from the concept of illness to the concept of wellness. And that is what we are trying to drive in, as Suresh is mentioning to us.
Can we take a question or two over here?
Yes, please, Mr. Terence.
Yeah. So, hi, I am from CSR for Bengal, representing a district hospital by the name of St. Joseph's Hospital, which is an NGO hospital in a tribal, very backward district of West Bengal. And, we've been toying with the idea of how do we introduce cancer care into our hospital, because we do have the civic infrastructure available to accommodate a cancer, addressing cancer in some form or the other. And we already have 2 oncologists who visit us on a case basis for basic chemotherapy, etc. Now, the question is that if we would like to, adopt a more holistic approach to cancer in our hospital, and I saw a slide which you sort of, I think possibly went through very quickly or skipped, in which there are different levels of hospitals who are associated with you. So I wanted to understand is that as a hospital in a tier 3 backward district of a state of West Bengal, what is the actual scope of alliance? What would be the flow of knowledge sharing, and what are the semantics involved in starting things like community, like the wonderful work which you've showed in terms of community screening, in terms of diagnosis, in terms of the entire life cycle of cancer care. And can we address things like palliative care, which appears to be something which is very necessary in places where, like I know from first-hand experience that a lot of patients from rural West Bengal travel all the way to down south for treatment.
True.
And then they come back and at massive cost. And I'm talking about people in from tier 2 and tier 3. I'm not even talking about people from Kolkata.
True.
And thereafter, the palliative care and the entire life cycle of cancer care treatment, which you would know so well, how do we address and fit into that gap at a tier 3, tier 2 location in West Bengal? Those are my questions to you, kind gentlemen.
Yeah, I would probably break this into 2 or 3 components of how, kind of Karkinos would ideally partner with any such, hospital. Point number 1, as I have been repeatedly saying, is we focus on the construct of wellness and not illness. So our focus would be to create awareness around the hospital where you are in that society, and proactively look at early detection of cancer. That would be our first prima facie focus. Point number 2, from a point of view of collaboration, I think there are multiple models where we can look at collaborating with such hospitals. In fact, as I spoke to you about the Kerala experience, we do partner with such hospitals in remote places. Like, for example, we have a partnership with a hospital in Munnar, which is again not close to Kochi. So we have multiple iterations. Dr. Ajit, would you want to kind of get into the specifics of collaboration, Dr. Ajit?
Yeah. So if you look at the model which was shown to you, that was what you were referring to. So the model has an L4, L3, L2, and an L1 center.
Right.
So the L4 center are centers which actually have a hospital. It's a hospital, but doesn't do anything much into cancer care. Cancer care is not a specific event. So what now Karkinos is trying to establish in these places is to ensure, to start with, the low-hanging fruit is actually set up some screening facilities. The other thing that is easy done is to establish daycare chemo. Now, what we don't want is actually patients to travel. If you want to make things seamless for a patient, what you want is now doctors are willing to travel across. So, but when we work in a partnership setting, what we want to do is not to take over work. What we want to do is to enhance whatever is the existing facility and to add on and to ensure, we have a kind of a education partner. Our education partner is Tata Memorial, which is the A1 cancer center of this country. So in order to educate and, fine tune their surgical skills, because we want them to also, enhance whatever is the care, because they are the local doctors. So partnering with them, so it's partnership in all sense. So a L4 center becomes something like an L4 plus center, because then the basic care of the surgical part is also taken care of in that particular center. When you go to L3 centers, these are centers which have some degree of cancer care, but then what is lacking is, various modalities which are required to enhance, say, a radiotherapy setting. So maybe, partnering in order to ensure that there is a radiotherapy setting. L2 centers are centers which are already existing, which are the cancer, in a way, a private center which is doing cancer treatment. But what is required is, the next level, say, enhancing them in what is called the virtual tumor boards. They may be challenged in the higher end tests. So we partner them in getting those tests in the clinical pathways that Karkinos has. So it is that higher level of engagement that we kind of make sure that we do with an L2 center. And L1 is something that we consider, we could also get into our own centers of excellence, where we look at something called the Advanced Surgical Care Center. Now, we would want majority of our work to happen at the primary areas at where the patient is, so that the patient does not have to move much. It's only in very specific circumstances where there are complex surgical procedures that need to be done that the care will be given at a very high-end center. And so that is the way that it's all graded. You did mention about palliative, and palliation is something that, fortunately, one of the biggest things and biggest strengths in, this is where, it's a collective effort. And therefore, in Kerala, for that matter, there is a very good networking of palliative doctors. There are many organizations like Pallium India and all, which actually, so therefore, whenever there is a patient who's challenged on those grounds, it's just connecting to that. So, just make sure that there is a seamless movement where the patient gets connected to such organizations. So we help them connect to the organization and then help flows in. So that's the kind of, very kind of efforts that can be made.
In the interest of time, we might just take just one more question, if that is all right. So Dr. Tony has asked, is there a plan for psycho-oncology services in the future roadmap for those patients who've been diagnosed with cancer?
Yeah, very, very interesting question. Ajit, would you want to take this?
Yeah, so this is a very important thing, because, that's where, the way we have modeled this is kind of what we call the care mitra. So there are various ways of looking at it, because immediately, if you become only a center which is actually going to diagnose cancers, you're leaving a patient at, to their troubles. It's there that you need to then handhold them into the entire, explain to them, give them the options. Yes, the choice is theirs, but then, because that's the start of that kind of a movement where we kind of are there to help him out. When the patient goes through this journey and through the journey and later, yes, they need a lot of support. And this is where, in fact, if you look at it, there are psycho-oncology nursing. It's a very specialized kind of, a group of people who are now getting ready. So this is where, these are the people that we are onboarding onto our system, so that, that kind of care which can be provided to him is provided. So this is something that, is something which is just beginning to, take roots in this country. And I think we need to go a long way in this country to make sure that this is done. It's too early days for us on this, but something that I think we all should ensure that we make forward movement on these aspects.
Thank you so much.
Thank you, Dr. Nambiar. Just there are a couple of more interesting questions from Dr. Changte and Mr. Dhanya Narayan. If I could request all of you to please fill in your contact details and questions in the feedback form. We can connect you post the webinar with the concerned teams to take these engagements forward. Our next innovators today from Selco Foundation, we have Mr. Bharat Karunakar Shetty with us. He's a public healthcare professional and has been working with Selco as the senior manager, leading their health vertical program. He's played a key role in implementing and scaling up of health and energy nexus intervention. His key expertise are program management and implementation, government engagement, community engagement, and monitoring and evaluation. With that, over to you, Mr. Bharat.
Okay, thank you very much for the opportunity for this talk. Yeah, so I'm just going to talk about the Selco Foundation work in the renewable energy and health, especially solar. The main aim is to basically how we can catalyze the sustainable delivery of health using via SDG 7, that is access to clean energy. So we all know that there are sustainable development goals are there like 7 which focus on clean energy and 3 focus on improving health and well-being. Whereas also we have SDG 3 that is climate change, climate action basically. So we work in this area so that how the access to clean energy can make a difference in the public health facilities basically. One, basically to develop an effective healthcare delivery at last mile connectivity. And when we really focus on energy, basically we also not only focus on putting solar panels, we also look into what are the critical medical equipment technologies can be really we can really deploy which are energy efficient, so that the energy can be saved in the long run, and there will be also there will be a reduction in the carbon footprints in the long run, and also see that how this energy the public health facilities can really become strengthened to provide the service for underserved population basically. So as we know that basically we have 3 areas, especially health sector, largely implementing largely public health programs. We do have energy sector basic, but there are a lot of gap is there in the health sector. Even today, many of the places they are not aware how energy can play a critical role, and also energy efficiency, why it's important, and how it really adds in a value for that, and how alternate energy can really makes difference in improving health facilities. And energy sector also there are a lot of lack of awareness on how a customized solution can need to be developed, and also like how the energy efficiency in the health facility should be looked into that. So our main aim is to bring in both health and energy nexus together. So wherever we implemented so far this energy health next work, we understood the gaps. What are the gaps in the health facilities in terms of energy needs, and also by conducting joint health visits basically, and doing assessment of these facilities, and developing an efficient customized solutions with also an efficient medical technologies for improving health facilities basically. So we started this is a program Snapshot, but I would like to bring in here. Of course, Selco Foundation is an NGO which has been working on 2010, but our health work started in 2016. We started in few places initially, piloting few solutions, working closely with some of the NGOs like Tribal Health Initiatives, Swasthya in Odisha, CNS in Assam, and also GDS that is in Malkanakri of Odisha. Basically, we developed a few models there. Later on, it moved into the larger piloting, larger applications with the close to 150 health centers with the partner Wish Foundation, Karnataka Trust, Doctors for You, and we touched upon various geographies in this. So this really gave us a good learning, how solar energy is adding value for the health facilities. Then we started gradually get into the scaling with the government. Especially with our main geography basically was Meghalaya, which we started working there. After that, we moved to the Manipur, Odisha, and Assam, and also Karnataka. Also, initially we started Karnataka. These are 5 geography main geography working. But in Meghalaya, basically, this given a good opportunity to the government, where initially we did few pilot. Later on, based on the pilot findings, we could able to got a new project of 100 sub-center solar powering with efficient medical technologies, especially the health sub-center in the Meghalaya, where they want to strengthen last mile connectivity. This is one of the biggest breakthrough what we got from the government, where government put in 65% budget from their side, and we put around 35% from our side for the training and also for the deployment and all those. Then also work with the other district, other district administration to work with. After now, we also moved into the larger scaling up, especially now with the different state partners, especially in these states, Meghalaya, Manipur, and also in Odisha, Kerala, we started working with them. Now a big programs happening in Meghalaya and Manipur right now, and also Odisha and also Karnataka, we have started working with that. And also in the Nagaland, in one of the district in Nagaland called Mon district, where we have an active partnering with the district administration there with especially DC there, and we are going into we are trying to implement there also a few of the solutions basically. Now our aim is to say basically in the next coming 5 years, at least we should aim at around 30,000 health centers at least in the 5 states. That's what we are looking for at the national level. Now recently we also got an opportunity to scale up around 1,700 facilities in the 10 districts, the 10 districts in 5 states. This is basically a health scaling up we got from the crypto relief fund, and this is one of the biggest program we have. Another 1 year, our aim is to complete this entire powering of 1,700 facilities. And here we also try to bring a lot of learnings, how this learning can be transferred in these 5 states to cover 30,000 healthcare facilities. Apart from that, we also work with the WHO, UNICEF, some of the technology solutions, especially how solar can be play an active role in improving the vaccination coverage or vaccine solutions, and also other healthcare facilities in other countries. Basically, these are some of the milestones what we have. So we mainly focus in the basically maternal and child health value chain. That's one of the key focus, especially in these geographies, the Meghalaya, Manipur, and Odisha, where the MMR is still an issue there. Basically, we focus mainly on the prenatal care, especially community level, developed few solutions with and also the intranatal care has been sub-center where we provided solar solution for the sub-center, which didn't have power earlier, and also provided few equipments in consultants and government. Now we were able to strengthen this sub-center with the efficient labor room equipment so that they can start conducting deliveries at the sub-center. So this can really result in increasing institutional deliveries and also neonatal care. Basically, these are the 3 areas we are focusing. Are largely focusing on this, but we also work with various stakeholders at different level, individual level, village level, district level, because these are the very important, how we can engage not only working with health facilities, also to engage the local community workers, ASHA workers, ANMs, and also there are RKS committees there. That is called Rohi Kalan Samiti, ARS committees there. Why you want to involve them? Basically, one of the challenge comes in the solar. Basically, who will pay the operation and maintenance cost for the solar? So wherever we implemented these solutions, we try to bring in the MOU between this ARS committee and a vendor, so that maintenance of the solar can be taken care of from their untied fund. Then we also work to the district health office, the DHOs and health secretary level to get in the buy-in from there to implement the solutions, and also how we can replicate at the larger level across the state, basically. And now we are also working closely with at a national level. NHSI, we had recently an MOU with them. They want us to develop a training modules focus on different stakeholders. Now the plan is to see that how we can integrate these programs at the largest national level, basically working with this National Health Mission and NHS. That's a plan what we have. As I mentioned, basically, why we want to focus in this area. Basically, one of the things what we want to try and do in this last-mile connectivity, how we can decrease the transaction cost among the people vulnerable population who are dwelling in these places, and also how we can reduce the patient load at a district hospital. What I mean to say that basically many of the deliveries can be taken place, and normal deliveries can take place sub-center or PSC. If we strengthen PSC and sub-center, people going to district hospital can come down, and also it can also reduce the transaction cost. If you see the NFHS data, what we in some of these states like in Manipur and Meghalaya, the out-of-pocket expenditure is very high, especially compared to an Indian average, basically. So this is the main focus what we want to try to do, to strengthen last-mile connectivity with the innovative technology solution using solar, basically. So when we really design this intervention, we will focus larger ecosystem of health nexus. Basically, we have 5 pronged approaches. One, basically, whole technology designs. What I mean to say that basically, when we really develop these designs with energy efficient appliances, along with the solar design, we can really reduce the solar cost. What I mean to say that, when we do an assessment of any health facilities, we look into the various libraries like bulbs and tubes. What kind of energy consumption they are having? Can we replace with the energy efficient one, or can we look at equipments which are consuming high energy one? Can we replace with energy efficient one? If in this approach, what will happen basically, your solar cost will come down, and energy can be saved in a long run, and it can also add on to your savings, basically. That's the main thing what we're focusing on. Second, very important, training and skills, because in the health facilities, many people are not aware how to operate and maintain solar. We focus mainly on this, especially building the skills of the healthcare facilities at the PHC level, at the sub-center level, how they can operate and maintain solar, and what minimum things they should know about that. What are do's and don'ts? Whom they should call when something goes wrong, and how they can take care of batteries, how they can take care of panels in a long run. That will really help to really to maintain this equipments very well. Then very important, the service and delivery at the local energy enterprises we focus, because one of the main thing in this geography, basically, we need to have a quick turnaround time to address these issues. So our main aim is to basically to build a local enterprises their capacity, so that anything goes for solar, immediately they can address these issues, so that there will be less turnaround time for that. That is what our main aim is, basically. Second, we also work with NGOs in the PPP model which are working in the state, because many of the innovation which we started earlier as I mentioned earlier, we took support from NGOs which are implementing PPP models, tried and test out a few models, and also started replicating those things. Plus, we also focus on even the mobile health units. like about the mobile medical units, and also in some few places board clinics are there, in especially Assam. There we focus on those areas basically. There's some innovative way of delivery, how we can really strengthen those also. And financial ownership, another biggest important things for what we're focusing basically. One, basically all procurement guidelines for the solar itself. Now, for example, like once after 5 years down the line, there is always an issue with the replacement of batteries, which will cost to some amount. So how we can procure this, how this kind of guidelines can be set within the health system or energy department, so that there will be a continuous engagement of these stakeholders, so that it's been the budgets have been parked for these things. And also we also see that how we can really we are also looking into basically the financing models, like what are the various model available within districts. Like what happened basically in many districts, there are different fundings available. Like, and wherever we tried out, for example, in case of West Gaur Hills, one of the district in Meghalaya, where we could able to do a 6 sub-center initially, where 60% money was brought by the DMF fund. Like, they put in the money, and remaining for 40% money, whatever we put, provided from our side basically. So we look at different financial model available within the district, so that these issues can be addressed at the district level also. And one more example I can quote, basically in Nagaland, we are working slowly with the DC, with Honorable DC sir there, where sir is really very keen to getting support from the local MLA funds and all those. So these are various models we are looking in this, how we can unlock financing. Finally, the policy level, because these are which is in a long run, we also see that, like, in the coming 3-4 years, how a health energy nexus can work and get integrated into the overall national program. So it can, so most of the PAC and sub-centers can be really get solar powered. So these are the 5-pronged approaches what we have. So far we have done, this is the milestone what we have. We have covered on 1,000+ interventions so far, and 2,000 we have planned in the coming years. These are the various states we worked around. 15 states we have interventions basically, and these are the various partners whom we engaged with right now. Now next plan basically, now we have, as I mentioned, we got a fund from this crypto relief, which is 60 crore. In the next coming 1 year, we have to really focus on 7,700 powering health center basically, especially in Meghalaya, Manipur, in Odisha, Karnataka, and Nagaland. What we are trying to do basically. So see, this is one example I want to quote here basically. If you see this table, I want to focus you onto this table, labor room table. When we really do an assessment of any facilities, we look into these kind of power consumption and all those. If it is a highly energy efficient appliances are there, your solar energy requirement will come on around 7135 kilowatt system basically, right? Whereas if you consider efficient appliances, your energy requirement is almost 2440. There is 66% reduction is there. So your solar cost also come down, even though, and also it will also cost less amount also for to system basically. This is how everywhere we are planning these kind of approaches basically when we do an assessment. So this is one of the program, as I mentioned, Meghalaya and Manipur, which trying to do basically with right now. So we are one of the we are closely working with the NHM Meghalaya to solar for 200 sub-center right now, and we also put a joint proposal NHM Manipur, and also we did 11 center earlier. Now the scaling up of 11 centers in the plan. It includes basically energy assessment, system design, procurement, and installation along with the government, and the training part. Apart from that, we also deployed few technologies like solar powered vaccine refrigerators in few places, and also now we are also deployed around 50 units of the portable vaccine carriers, which is again an active vaccine carrier, especially to strengthen the last mile immunization, especially difficult areas like Manipur and all those, where the outreach will take more than 8 to 9 hours. Because the terrains are very difficult. ANMs have to really walk there. The regular sometimes ice packs, it will melt, but the solar powered active vaccine carrier can really hold vaccine 2 to 8 degrees centigrade for up to 12 hours basically. This is what some of the innovation what we have done. We also focus on immunization, labor room, mobile health units, as I mentioned, oxygen centers. We started focusing on that, COVID care center, and TB testing center basically. So these are some of the testimonials what we have basically from the people who are actually using it. Basically, if you see one of the medical officer in Kamjong, which is a remote area, ever since they got a solar, they are dependent on the total. They are not least bothered about the power cuts now. The solar is available at any given point of time, which is really helping them to provide better services, especially at the CSC level. So this is another some of the testimonials. I'm not going for all, but for the time constraint. But if you see that this is the Tamenglong district, which is really a remote part of the Manipur. It has really a hilly terrain. Basically, here we have powered the PSCs and also three PSCs and one district hospital currently will be powering now. There, this has really helped them, especially in a remote area where the staff is happy now. They can able to function better, and it really helping to maintain the cold chain equipments, especially during COVID crisis, which is very important. Otherwise, power cut happens. Even they don't have, like, the roads are cut off. They won't get diesel on time. All those issues are there. Whenever solar is in place, these are the issues they will be able to address. They are able to provide better services. Now, one more thing I want to bring in here, basically, we also focus on last mile connectivity, as I mentioned, basically. See, one of the things what we see basically in these places, the maternal, under maternal MCH program, the ANC checkups among pregnant women is very low, especially if you see the NFSS data also, it's less than 50%, because pregnant women can't come to the health centers every month because of difficult terrains. What we've done basically, when ANMs go to their homes, we provided them a kit, solar powered kits. These kits contain few equipments like BP monitoring, anemia monitoring, blood sugar monitoring kind of thing. They go there and they do a lot of checkups there. If any pregnant woman have high BP or high sugar level, they are referred immediately for higher referral centers. In this way, the ANC checkups are increasing. This we deployed almost, I think, 60 kits right now, 19 in Mysore, and remaining kits in Manipur and Meghalaya already deployed basically. Apart from that, we also focus on labor room equipment, radiant formers, phototherapy units, efficient spotlights, lab equipments, cold chain equipments, ICU and operation theaters. We already we focus on that also in these places basically. So these are some of the example. I won't get into this. I think some of those testimonials which I just wanted to tell, and I just want to bring in basically the board clinic here, which is in Assam. Which when we did this board clinic, this board clinic entirely depended on a diesel generator there to run the lab equipments. We did an assessment of the board clinic and provided solar solution for the board clinic, which where they started using the lab equipments and other equipments, basically cold chain and all those using the solar energy. This could able to save a lot of diesel consumption. Because of that, their coverage also increased in case of Assam. And in case of during COVID time, we powered one of the Christian Missionary Hospital, which was designated as a COVID care hospital, basically in Jamshedpur, in East Singhbhum, basically, where they were totally dependent on generator earlier. And now, ever since we installed solar, the dependence on generators has come down. There's also reduction in electricity bills also. So these are some of the innovations which I want to bring. Apart from that, we also, as I mentioned, COVID, of course, everyone, as Sir rightly pointed in the beginning, it was in the wake of COVID has really given a lot of opportunity to us to do a lot of innovations for us also. Basically, we also looked to the entire COVID value chain, starting from screening to the care. What else solution we can develop for the COVID? We could develop few solutions during COVID crisis. These are implemented in the different part of the country, and I'm talking different state basically, especially on this for the screening and also for the quarantine facilities for testing or a therapeutic care. For the screening, we could able to develop few kiosks, and wherever they had a mobile testing kiosk, we give a few solution powering of this mobile van to run their fans, lights, so that there could be there is an ambient atmosphere for the person who's working in the van, because they're totally dependent on the generators or to the vehicle battery to run these fans and tubes, and we provide solar solution for that. And quarantine facilities also we are able to provide in few places, especially in Orissa. Many of the panchayat buildings, when the quarantine facilities they identified, many of the panchayat buildings, school buildings didn't have a power basically. So we identified these needs along with the local authorities there, engaging local stakeholders. We powered these quarantine facilities during COVID crisis, and they use it now. These facilities they're using for the vaccination purpose, for conducting meetings and all those. Then of course that are therapeutic care. I mean to say that we also set up few quick hospitals. In Bangalore, we have done one COVID hospital, and also in Patna, we have been able to do one COVID care hospital where this is being solar powered hospital. They are able to provide cases for even critical cases, care for critical cases like which you run by using ventilators and ICU. They use solar power for that, which has really helped them in a COVID crisis basically. So these are some of the things, and this is a hospital which I mentioned in the Bangalore what we have done. I just want to get into and these are the various photographs of this for example, as I mentioned, DF5 we have done that COVID care hospital. I won't get into much of this. There are other COVID responses which we did basically. the kiosk and powering mobile van, and also the vaccine carriers. And even we also powered the some of the PSCs, especially in these terrains where the cold chain was an issue basically, and because of the power, reliable power, they were not able to maintain that. They were a lot of struggling. They were struggling to keep the vaccines. Many times they have to send vaccine for other PSCs when the power was not there. Because in these places, if power goes, it will go for 3-4 days, especially in rainy season and all those. That's the reason we took this opportunity and tried to bring in the solution here. This really helped them a lot. So the overall, if you see the impact, I would just want to bring when health and energy nexus work basically focus on 5 key areas. One is of the availability of services, because of one, it prolonged the opening hours of health facilities and wider range of service they can add. Telemedicine also is really help if they can add, because of having reliable power in the place. Second, logistic admin has really improved because for the better communication and improved record management, timely they can send reports. Very important, many of the sub-center, when we did the powering, the ANMs felt the sense of safety for them. Having street light in the sub-centers, they could start staying there. Because of that, they could start conducting deliveries in Meghalaya. That's something which is very an add-on evaluation happened. The recruitment of also happened in few places. Staff started training, started retaining there in the centers. And also the service like cold chain, neonatal intensive care are really improved because of the COVID basically. So these are some of those studies what we have done, how it has really helped. Like 83% decrease in the vaccine, in vaccine wastage, because of having reliable power in place because of solar. Then the extend hours has really improved because of having energy in place, especially in the health centers. Then even the entire diagnosis part in the laboratories, that also another big add-on value, because many of these places basically whenever the patient comes there, if the power goes, the patient has to come next day to get a report. In this process, what will happen? Patient has to spend a lot for the travel also. In these places, to come into health facility is a big challenge. And again, patient have to spend a lot for the next day. Again, they have to come. But because of having this energy in place, supporting laboratories, now the lab test they can immediately do quickly, and they can also provide result on the same day. This is another impact which we saw. And also the patient waiting time has reduced. That's what another observation what we had. And of course, even the whole availability of electricity has really was challenging earlier. Now it has really helped a lot in these facilities. So this again, COVID, I mentioned what we have done. So basically, in the COVID again, we have done, as I mentioned, kits, solar swab collection kits, and powered these hospitals. As I already spoke about that, especially during first wave, we have done that. In the second wave, it was a lot on basically on at basic facility level, like mobile RT-PCR testing with solar powered, and few places whenever you deploy, some of the places where the oxygen concentrator deployed. To run this oxygen concentrator, power is an issue basically. We also powered few PSCs there, PSC, CSC, to run this oxygen concentrator basically. This was done in the second wave basically. So I won't get to much of this. I think this is another 4 or 5 areas basically. As I mentioned, we also focus on walk-in cooler, walk-in freezer in the state level, and also the deep freezer and ILR at the PSC level, and also the last-minute connectivity. We're focusing portable vaccine carrier, which is already deployed in a few places. So this is in a nutshell. And if you see our overall the COVID hospital, COVID therapeutic care, like we focus, as I mentioned, the more mild and moderate cases where we did the powering of quarantine facilities. And for moderate severe cases, as I mentioned, we powered hospitals, especially in these places. What happened basically earlier in this hospital, non-COVID cases, the patient had a lot of tough times, especially pregnant women. They didn't have place to treat. For that, to overcome that, we constructed an OPD block for that. So that this has really helped especially in BR hospital. And we could also provide few temporary facilities, especially and also in last one. This is last one cancer hospital we have done in Muzaffarpur, because this is one of the requirement came from DF5, where to treat cases for the OPD basis for a daycare therapy of chemotherapy and all those. This again entire into solar power basically. So this is in a nutshell. Thank you very much for time. Any questions? I'm happy to type. Yeah.
Thank you so much, Mr. Bharat. That was really, really comprehensive. We would start with Mr. Rajiv, who had his hand raised ever since we started the session. Mr. Rajiv.
Yes, sir. Yeah.
Hello, this is Rajiv Chaudhary. Can you hear me?
Yes, sir. Very much, sir. Please, sir.
Yeah. I live in I'm a doctor, oncoplastic surgeon. I live in a village in MP called Padhur, which is in Betul district. So
Okay, sir.
I just want, because you talked about this, I just want to, Act is sitting over here. I thought I would just mention that about 7-8 years ago, we thought we had the most expensive oxygen in the world because we had to send a vehicle full of cylinders all the way to Bhopal. Before that, it used to be Indore.
Yeah.
And then 7 years ago, we got this PSA plant as a funding from the Japanese global grants. And at that time, they were not like everybody else. Nobody was interested in giving for health. So just to make it compatible for them, they wanted to give for environment. We took a plant that was solar powered. So we got this oxygen power plant that was solar powered. So for the last 7 years, we went from producing like maybe giving most expensive oxygen to one of the cheapest forms of oxygen. All we were doing was paying AMC of both the plants and the oxygen plant. And so that is one thing I wanted to say over here. And it's nice to hear that, this is the work you're doing in healthcare places, because healthcare is expensive. And getting good healthcare to people who are in rural places means bringing the cost down. And this is one of the big ways in which we can bring costs down. So actually ACT will, if they go through their file, see that we had requested for a solar powered power plant, oxygen plant. I don't know if they're going to do anything about that. Other thing I wanted to mention was, which is a little from before your oxygen, the solar part, is that we have tried screening for cancer diseases in 80 villages surrounding our tribal territory, Goans.
Yes, sir.
And
Yes,
I just wanted to highlight that it needs a lot of, shall we say, education or awareness to be created. And because screening happens in people who are asymptomatic, who do not have any symptoms. Cancer cervix can be picked up to 10 years before it becomes symptomatic. And we know that head and neck cancers, which I do a lot of, also, the target population is very fixed and very easy to screen, but very difficult to bring to bring into the premises. And even if you go out to them, it's very difficult to get their mouths open. And breast cancer can also be picked up way before it becomes symptomatic or dangerous for the patient. So screening is so important. Also, I think you should look at palliative care, since you yourself have enunciated how delayed presentation is the biggest problem, and palliation is something that is really neglected. Getting technology into far flung areas is very important, and I have already talked to the good colonel about that. So thank you very much for this program that you have arranged for us, and I shall stop here.
Thank you, sir.
Dr. Rajiv. Yes, thank you for your inputs. Really appreciate. Mr. Bharat, we have a question from Dr. Chante. He's from Mizoram. He has a query that their state does not have, the Sarchip district in Mizoram does not have any power backup, especially in the PHCs and CHCs. So will it be possible to install backup in the facilities? And if so, how much energy?
Basically, definitely it can be done. We can do it. Basically, right now, our main focus states are Meghalaya and Manipur, what we have, and also one district in Nagaland we were focusing. But for CHC, PHC, we can really, if they need any support in developing the technical designs for this, doing an assessment and coming out for the designs and the costing, we can do it for them. Definitely we'll do it. It depends upon how the kind of service the PSC is providing, like how many deliveries conducting and how big is the PSCs. Generally, what happened as per IPH standard, there are set guidelines are there, for the PSC around. Generally, each PSC have around 16 to 17 rooms when we look into that, and we mainly consider basically the very critical, cold chain, labor room, and also the laboratory, what kind of equipment they're using, and the kind of luminaries they're using basically. What we can do basically for Mizoram right now, we don't have any focus on from Selco Foundation. Focus is not there, but there's a talk is going on about that, especially with maybe in the coming month we'll be having a discussion at the national level. Even Mizoram state, and I think NHM also going to join for this call. There we can really talk about that. But meanwhile, if they need any support for this, basically we can do a remote assessment. We can remote assessment, give a design and costing for them. That can doable from our side. We can do that, no issues. Yeah.
Thank you, Mr. Bharat. I hope, Dr. Shanti, that answers your questions. Would also request you to please fill in the request in the feedback form, sir. We have another question from Mr. Rashi Satar, who's asking how during rainy season solar plants will be able to help.
See, basically what happens, this is more, when we design the solar, we also look into the different geography, terrains, sunshine hours, and all this has been considered by the technical team. I think they are best because they consider these things into factor. Like, for a Meghalaya, Nagaland, there will be a different sunshine hours, and for Meghalaya, different sunshine hours, and all these things are considered, and solar is designed accordingly. And especially in these days, when we really implement solar, we also tell them how optimized they can use in such situations. Like, generally we get a call, like, sometimes we also how they can really use it. Optimally, they're optimized, they can use it basically. But while designing these solar, we'll consider all these factors in place, like, rainy seasons, the sunshine hours, and all those, like, that's been considered basically. For this, in case of Nagaland, we take 4 days backup, it seems. Whereas in Karnataka, if you want, we did 2 days something. We'll do like that's something. Some technical, it's more of technical questions, but we do consider these aspects into that actually.
Of course. So he has another question. Is it possible to run mobile medical unit on solar power?
Yes, we have done basically. See, basically we have done in Assam with the HLA PPT. We partnered with them. They are running the mobile medical unit of the Assam government. We powered the mobile medical unit. But what happened basically, there are certain things we all need to see what equipment they're using. See what happens in the vehicle also. There is a constraint for the space to put panels. But definitely some of the things we can definitely will consider a few lab equipments, and maybe the vaccine care, the battery operated vaccine carriers we can definitely consider. That we have done, especially in Assam we have done, in Karnataka we have done. We also done in Manipur also one, that can doable. See what happens basically generally when in case of Manipur, when they're using this van for especially for HIV testing, they're using this van. When they go into community, they were using this kerosene to run their TV and lab and all those. And after that, we assess the needs and we put a solar. When the moment we put a solar, they stopped everything now. They're running everything, the equipments and TV by solar itself. It can doable. It depends. We also look at what equipments we can cover. Minimum equipment definitely we can cover. It's doable basically. We can do that. Yeah. Yes.
There is also a question from Ms. Malavika. Will solar power be a good substitute for HD power?
This is Malavika here.
Yes,
yeah, it's high tension power.
High tension is a grid power, right? Grid power you're talking about, electricity, regular electricity.
Yeah. The reason is because currently in our hospital we have about 2 oxygen plants, and we are looking at going for a high tension power. So is it possible if solar power could be a good substitute instead of high tension power, instead of going in for the regular electricity, the high tension electricity?
See, I don't know much about high tension power, but I can answer your question for us PSA plants. You mentioned PSA plants, right, ma'am? Correct, Malavika ji? You mentioned PSA plants. So for the PSA plants, so far we have not done any. We are not solar powered anywhere so far, but we are studying these PSA plants carefully, because one of the reason why because these PSA plants, they have a lot of this power. It depends upon the capacity of the PSA plant. Like some are 200 LPM, some are 300, some are 500, some are 1000 LPM. So it varies from the capacity, number one. Second, the kind of equipment they're using, we are just trying to study these equipments right now. We have not done so far any powering of the PSA plant, but still the study is going on. Number one. Second, the third thing basically,
Okay.
if you're putting this high tension power for the solar for the PSA plants, I think because that can support. Because what happens in one of the challenge in case of solar, if your capacity is very high, then you need so much of panels, space to put panels. Those are some of the constraints are there. But regarding high tension, basically, I'm not much sure about that. Basically, I'm not not much about that basically. But these are some of the thoughts of mine. Yeah.
Okay. Thank you, sir.
So there's one last query, Bharat, which is there.
Yes,
Another challenge in remote areas is internet connectivity. So have you implemented any solar powered mesh networks in difficult terrain, such as the Northeast, to help improve internet connectivity? If you can take that on, please.
See, basically, we have not done for any internet connectivity as such. Basically, wherever we went, we powered the health facilities and see that the modems, the whatever internet equipment they're using, they are considered for the powering. That we have done. But not exactly for the anything like internet related. We have not done so far. But those equipment, what they're using in the PSCs or CSCs, that we have powered that basically. Yeah.
Right. I think that's what we have tonight. And at the outset, I'll just wind it up for everyone. So it's a big thank you to everyone, whoever has taken out time for attending the event, first of all. Secondly, I would also extend a big gratitude and thanks to both the Karkinos team as well as the Selco team, who have put in so much effort to bring forth these two lovely innovations to the entire community. I'm sure there have been a lot of questions, especially when we were going through the Karkinos presentation. We had a lot of questions. We still have a lot of questions which remained unanswered. So going ahead, what we will do is we would prepare a document with all the questions. We'll share it with the Karkinos team and have them answer all those questions. And once those answers are there, we would share those FAQs with the entire community. I think that would help document it, as well as going forward help everyone in understanding the concept, what Karkinos is bringing in a better manner. Apart from this, do also fill in the feedback form, which has been time and on time shared with you in the link. So that whatever queries you have, those queries are addressed in those feedback forms, and offline we can have a look at all the queries and then maybe take them on one-on-one on a personal note with all of you. I think that will be a big help, and going forward, that will help us maybe bridge more relations with you. Apart from this, what Selco Foundation has brought about, they talked about a lot about solar energy. So the biggest part about the solar energy is it's an inexhaustible as well as a renewable energy. So there is so much to explore, especially in tier 3 cities. We cannot take away the fact that yes, even in tier 1 cities, it helps a lot, but especially in tier 3 cities where still electricity is a valuable item, I would say. So it is a big resource there, and there is so much to explore. So Bharat has actually given us just a small insight on what all can be achieved with this solar energy. So it is just left to the imagination. We can do a lot with that, and I'm sure going ahead, more as we keep on partnering with Selco Foundation, I'm sure we're going to do a lot of good work, a lot of positive work in all the tier 1 to tier 3 cities. So the scope of both Karkinos as well as Selco Foundation is immense. The community, as a community, we need to explore, we need to reach out to them and maybe tap on to that resource which has been brought forward to you. And I'm sure we would achieve a lot of positives, lot of good vibes, and I'm sure this is going to go a long way. So thanks a ton, everyone. Thank you for being there, attending the session, making us again motivated to carry on this initiative. And we hope that we keep on bringing such initiatives in the future also. Thanks, everyone. Rachna, in case you like to add something, you can please add on.
No, thank you so much, Sadhbir. You covered all the points. just a humble request again to everyone. Please fill in the feedback form with all your queries. And as Sabir mentioned, we will prepare a document with all the questions and get them answered by the relevant organization and share it with all of you. So just request you to please fill in the feedback form. Thank you, everyone. Thank you for your time and attending the session.